Do you have an extra $140 per each member of your family? If not, you might want to get it together in case you want them all to get the updated COVID vaccine. You see, the Health and Human Services Secretary, Robert F. Kennedy Jr., took to the X platform and he announced on social media that the Food and Drug Administration, or FDA, has released updated approvals for individuals who should get the COVID vaccine. The updated list include adults who are 65 and older, or anyone, kids or an adult, who has at least one medical condition that puts them at risk for serious illness. Now, of course, Kennedy didn't list what those conditions are, but I'll tell you about them in a little bit. And also, the emergency use authorization for the updated COVID vaccine, all of those have been rescinded. And really, there was only really one still in existence, and that was for children age 11 and younger. Now, all this is happening now when we're getting ready to enter the respiratory virus season, which is really critical for, well, infants and toddlers because their lungs are still small and developing. But now's the time to limit access to the COVID vaccine. Excellent. Your doctor can still prescribe the vaccine for you if you're not in that limited pool of approved people. But, well, don't you usually go to the pharmacy to get it? I know my siblings and I would do that. Walgreens, CVS, maybe your local grocery store or grocery store chain that has a pharmacy. And that's where we would get our vaccines. Y'all let me know in the comments, where did you get yours if you got it? Now, also, when you go to the doctor to get that prescription, don't you have a copay? So now that $140 has gone up already, right? Now, that $140, if you go to the Centers for Disease Control and Prevention website, that's CDC, they will list the average cost of the COVID vaccine shot, and it's $140. That's this year. What is it going to be next year and the year after? Because you see, just like with the flu shot, you need to get the COVID vaccine every year. Yeah. More money out of our pockets. And don't forget, people are losing Medicaid and Medicare because of that big, beautiful tax bill. Yeah. Now, again, you're thinking, well, why is it going to be that way? Why do I have to pay? Because, well, with this limited pool of approved people, more than likely your insurance company, well, they're going to follow that too. So that will impact who they're going to pay for the vaccine for. So if you're not in that pool approved from the FDA, your insurance company's not going to pay for it. Thus, you got to pay the $140. Thus, you got to go to your doctor and get a prescription if you want to take it. Now, as far as that list of medical conditions, if you go to the CDC website, they do list some medical conditions that would get you to qualify for the updated COVID vaccine. And it's quite a few. The article I read listed a few of them, and that included asthma, cancer, heart conditions, diabetes, disabilities, and depression. But that's the list right now. Do you think it's going to be decreased? To, again, basically restrict access to the COVID vaccine. What do you all think about that? That's what I think. But you all leave a comment and let me know. And don't forget what's going to happen now. See, the FDA released what their approval or whatever. But now it's going to go to the CDC Vaccine Advisory Committee. And then they will release their final recommendation on who should get the COVID vaccine. But that committee, remember back in June of 2025, Kennedy fired all 17 members on that committee and put in his own people. And also remember that when Kennedy was going through the Senate, trying to get approved to be the Secretary for Health and Human Services confirmation hearings, he had different, and that's in quotes, ideas on who should get vaccines. And correct me if I'm wrong. Didn't he believe that some black people, well, not some black people, but black people, period, well, we didn't need some vaccines. Do y'all remember that? Yeah. Now, usually major medical organizations would just go along with what the FDA and the CDC would recommend as far as vaccines. Not this year. They said, we're going to release our own advice, our own recommendations. For example, the American College of, obstetricians and gynecologists, they're recommending that pregnant women get the COVID, flu, and RSV vaccines. The American Academy of Pediatrics, they're recommending that kids get the COVID vaccine. And the American College of Cardiology is recommending that people with heart disease, that they get the COVID, flu, and RSV vaccine. Also, COVID cases are on the rise in some areas in America, namely in the South and California, because there's a new variant out there of the COVID. So, again, this is the perfect time to do this, to restrict the access. Perfect. And also, emergency room visits and hospitalizations, they're on the rise too in recent weeks. Still not as high as they were this time last year. But again, we're just now entering that respiratory season. So y'all let me know in the comments, what do you all think about all this? I think the timing is very suspect. And maybe they do this about this time every year, and they probably do. But you just don't know with this administration anymore. You just don't know. Well, let me give my recommendations and close this out. Keep demanding those documents. That's number 1. Number 2, black out the system, September 16th through the 20th, 2025. If you have questions about that, go to blackoutthesystem.com. And 3, keep your eyes on the prize. The prize is the White House and democracy in America. Do not get distracted by the foolishness, mayhem, debauchery, and lies coming out of the 47th administration. If you like this video or if you learned anything, please hit that follow button, as it helps me out immensely, and I appreciate you doing so. And as always, thank you for watching and have a great day.